Hi YouTube, this is Luke Carnahan back for our first interview with Megan. And what do you do, Megan?
I'm a family consultant with Lifeline Youth and Family Services.
All right, and how did you get into that position?
I became a social worker when really I felt called to the field, and I went to school at Ball State and earned my degree for social work.
All right, and so you work with the reunification process with social work?
I do. So my role in the reunification process is after substantiated abuse or neglect has gone to DCS, to the Department of Child Services, I get a referral from the state to go work with the family based on what their needs are. So, and those can vary. I could do supervised visitation for the kids and pick the children up from the foster family and take them to see their mom or dad. Sometimes I do home-based services where I can go into the parents' home and work specifically on the goals that the state has outlined needs to happen for the reunification to happen.
All right, and so you work with the parents of the children that have had their kids taken from them. How do they usually act?
Really, the pattern that I'm noticing is that it kind of depends on why the children were taken. The pattern that I've noticed personally is typically when it's abuse or neglect, there is a lot of remorse from the parent. They typically want to learn how to do better so that they don't get back into the same pattern again and have the state involved with their family and have their children detained. Unfortunately, the pattern that I'm starting to notice with the opioid crisis that's in America right now is with drug abuse being what it is, we're seeing a lot of parents that are addicts not really take initiative to get clean, to be sober, to re-involve themselves with their children. It does happen, but it can be a much longer process.
Okay, so with abusive situations, how long does the reunification process usually last?
So the state has their own set of guidelines that, since I don't work for the state, I'm not super familiar with them, but it's usually about 14 months from start to finish. It can be a lot faster if the parents are very motivated and they take the initiative to complete the goals that the state has outlined for them. For example, it could be that they need to complete maybe a substance abuse class. They need to get involved with individual counseling. They need to have home-based services through myself or another service provider. When they're actively working on those goals and motivated to achieve them and the supervised visits are going really well, that process can go really quick. It can be 6 to 9 months up to 14. A lot of times, like I said, when we have a parent who's really heavy in addiction, you're gonna see them dragging their feet a lot. Sometimes they don't show up to visits with their children, which can be detrimental on the kids' mental health. You can see them not going to like their individual intensive outpatient programs, which are for substance abuse, which all of that in turn reports back to the state, to the Department of Child Services, as they are non-compliant with their services. That can really drag things out.
Okay, and so is this a very complicated process, like lots of paperwork?
It can be. I have a lot of documentation on my part.
Oh, okay. So do you ever work with the kids in the foster system or just the parents?
I do, and depending on the type of referral that I get will determine if I work strictly with the parents or with the children. When I do work with the children, most of the time it is transporting them, picking them up from foster family and transporting them to their visit with their parents. And that can be, since we are in more of a rural area, I could transport for anywhere from 20 minutes to an hour and 20 minutes. I do have, and I have in the past worked with a couple of older minors between 12 and 17 that might be involved with the Department of Child Services because of their own delinquent behavior. And they might be either in a foster home or in a relative placement, and I'll go in and work with them on making better choices, trying to avoid delinquent behavior, independent living skills, things like that.
And is the process usually traumatic on the children?
It really depends on what the case is and how severe the abuse and neglect is. One thing that I've definitely noticed is that children are extremely resilient. I might work with a couple of kids who are wounded because of what they've been through, but not completely broken. So they usually have a really good attitude about it. Sometimes when I transport kids, they might ask me questions about why they have to go back to their foster home, or why they can't live with their mom or dad, and I answer them. And I mean, kids are so resilient, they're just like, okay.
All right. And so do you see any glaring issues with the foster care system here in DeKalb County?
I really don't. The biggest issue that we're seeing with foster care in general is really a lack of good, solid foster homes. There is a huge foster parent crisis in which we've got, in Indiana alone, we've got 9,000 children that are in need of a foster home, and we don't have that many foster homes to put them in. So, and that could be for a number of reasons. A lot of times I hear, even through my own friends, that they would love to foster, but they don't want to get attached to children, which is such a backwards way of thinking, because you need to get attached to children. That's why these children are in these situations, is because maybe their own parent couldn't attach to them. And so they're just afraid that it's going to hurt themselves when the child has to leave, because Indiana does push for children to be with their families. The other issue that I see is a lot of times foster homes are designated for a certain age group. So because of other children that they might have in their home, they may only take 0 to 2-year-old children, or 2 to 4, or school aged. There have been a lot of cases where children have been separated because maybe the older child is 14, but mom and dad had a baby recently that's 1, and there's not a foster home out there that's able to take to a sibling group that big an age difference.
All right. And so what sort of overall impact do you see the foster care having on both the families it works with and society in general?
I see that it's a great program. The cases that I've worked with have typically been really positive. The family has always been very appreciative of the foster family stepping in when they couldn't be there. I think the impact is huge. I think personally I've seen a greater impact on the children and the families involved when the kids have been in more of a Christian setting, more of a structured setting that's more family-like, that they can take back to their nuclear families.
All right. So thanks for listening, and we will be back next month with our next interview.